Hi, Dr. Chrysopoulo. Thank you for taking our call. Christine Grogan with Brave, and Dr. Chrysopoulo is one of our Brave advisors. He's a board-certified plastic surgeon, president of PRMA, which is one of the largest plastic reconstructive surgery practices in the United States. So I thought, being that Brave is usually focused on breast restoration after breast cancer, Dr. Chrysopoulo, with the COVID virus, I know it's put a lot of challenges on plastic. Probably one of your patients is calling you right now.
Yeah, sorry.
Couldn't have been any better. No problem. This is our new world. You're probably getting some chihuahuas in the background, barking at me and my daughter. So, but I was reading the article that you have on your Breast Advocate app around breast cancer patients needing to know, and I thought it was a really well done article. Could you maybe just talk a few minutes about the tips that you're suggesting to these patients?
Yeah, sure. So the main issue, of course, for breast cancer patients is that or any patient with a diagnosis of cancer, or either in treatment now or just finishing treatment, certainly anyone who's recently finished chemotherapy, for sure. People who fall into those categories are very much like the other high-risk groups that the government has been talking about, the elderly, people with pre-existing conditions, heart, lung problems, kidney problems, diabetes, asthma. So anyone with a cancer diagnosis is in the same high-risk category as those folks. So obviously cancer can impact people of any age. Age really, in terms of cancer patients, doesn't have much to do with it. It's the diagnosis which trumps everything. And also, when you factor in the difficulties we're having now with coronavirus and COVID-19 in terms of tracking and really trying to understand the true extent of the disease, and the true rate of infection. And in addition to that, at least 25% of people who contract the virus will never develop any symptoms whatsoever. So it makes it really a very, very tricky disease for someone who's immunocompromised. It's a very tricky infection to deal with. And also there's no treatment right now. Obviously there's a lot in the media about hydroxychloroquine being given with a Z-Pak and zinc as a kind of a triple cocktail that some folks are banking on working, but the evidence of that really, so far the evidence we have is not of high quality. It's not good quality data. In terms of the studies, they're actually pretty weak studies, and so we don't have good data on which to hang our hat that hydroxychloroquine is the answer. So with all that being said, prevention is the key. And so I think all cancer patients, anyone with a diagnosis of cancer or who's recently gone through it or recently completed treatment, I think all those folks should be very OCD about protecting themselves. We've obviously heard a lot about social distancing. That term in and of itself, in basic terms, it just means stay away from people, minimum of 6 feet away from people. It does need to be done in the right way, and it's a very complex issue because unfortunately social distancing for many people also means social isolation. And so I think things like this, what you're doing, Christine, and lots of other folks out there, I think is phenomenal. The online support really is key so that people don't feel socially isolated, even though they are physically isolated.
And Dr. Chrysopoulo is very helpful. And if I understand right, I'm no scientist like yourself, but some people may have a harder time forming antibodies if they already have immunocompromised. So if they're near like their grandchildren or anybody that maybe can fight this coronavirus off, they could be more susceptible, and the grandchildren may not have any symptoms, correct?
Right. And, it's called a novel coronavirus. What that means, any virus, the word novel in front of it is bad news, because what that means is it's the first time it's been identified in humans. So people don't have antibodies unless they've had the coronavirus infection before.
Mm-hmm.
So there is an antibody test that's hopefully going to be available widely. It's not widely available yet. To be honest, I don't even know if it's available period yet. They're working on it. So the problem is that it's a brand new virus in people, and so whether you're immunocompromised or not, unless you've had the coronavirus, you don't have any antibodies to it. There are some treatments that they're looking at where they want to identify people who have had coronavirus and therefore have developed antibodies. And then if you use serum from people who have previously been infected, now you basically have the opportunity to provide others who haven't been infected, or initially it would be given to those who actually have severe symptoms as a form of treatment. So giving someone serum that contains antibodies to coronavirus from someone who may or may not have had symptoms, if you give that serum to someone with severe symptoms and who's in trouble, it could potentially be a treatment. That technique has been used before in other diseases with some success. So I think that's definitely got potential for sure. So in addition to staying away from folks and social distancing, I know it sounds like very, very basic stuff, but the whole point is to avoid the virus getting on you, primarily your hands, because then you use your hands and you touch your face, the virus enters your system through your mouth, nose, and eyes. So the virus then attacks your lungs primarily. That's where it starts. And that's why the symptoms start there in most people, not all, but in most. And that is also where the disease strikes the body first in terms of severity. So it causes significant respiratory distress in some people. The initial symptoms in most people are fever, a cough, usually a dry cough, and shortness of breath, initially with activity. So if all of a sudden you're getting breathless, doing something that really you would take in your stride before, that's a concern. There are other mild symptoms like just fatigue. A friend of mine, another plastic surgeon actually in San Francisco, was just admitted, and he did okay, and now he's back home.
Good.
But he was COVID-19 positive on testing, and he only had fatigue for a few days. For about 5 days, he had severe fatigue where he got to the point he couldn't keep his eyes open, and that was the only thing wrong with him. And then he eventually developed shortness of breath with activity, and that's when he went in. He never had a fever. So you don't need to have a fever for the alarm bells to go off.
Yeah, that's for these cancer patients, I think it's so important. I think we probably have about another minute or so. I just bought some hand sanitizer I found online. Do you have any, for somebody with, it's very hard to find hand sanitizer now. I'm not trying to talk about any brand, but for people that have cancer, suggestions on masks, sanitizers, should they have somebody else do their shopping for them?
Yeah, let's talk about that. So first of all, let's go back to the hand thing. And the sanitizer really should be a backup if you don't have access to warm water and soap. Okay, 20 seconds, warm water, soapy water, wash your hands, and don't touch your face. Keep your hands away from your face. Face masks were initially kind of, not supported in terms of the stance from the World Health Organization and the CDC. If you're watching video footage of other countries around the world, really they had a different approach. And long story short, now the recommendation is to wear a mask when you go outside and you're going to be surrounded by people. So if you're going to go to the grocery store, wear a mask. We're in Texas, you're going to H-E-B, wear a mask. Personally, for my family, when we go to H-E-B, we also wear gloves because the coronavirus can stay alive on other materials outside the body and on some metal objects like doorknobs and shopping carts. There's data now that shows that the coronavirus can live on metal for 3 days.
Oh my gosh.
Sometimes even longer. Some of the cruise ship reports suggest up to 9 days, which seems long, but bottom line is it can last for a few days. So doorknobs, keep disinfecting. Anyone who's immunocompromised should be cleaning their counters at home with a detergent, antiviral of some sort, at least once a day, washing their hands several times a day. You go grocery shopping, you have to presume that all the boxes you're touching in H-E-B, all the food stuff, all the stuff you're buying could have coronavirus on. So there's actually, if you go to breastadvocateapp.com and you go to the news section, there's an article called Coronavirus, What Breast Cancer Patients Need to Know. And I've got a whole list of things like what we're talking about, but there's also a link to a video that shows you how to disinfect your groceries before putting them away. So
I'm going to send that. I'm going to add that link, Dr. Chrysopoulo.
Yeah, please do. And then again, just so we wrap up, I know we're short on time, but most physicians are telling their patients to stay home for follow-ups that can be postponed. For your routine yearly follow-up, if you're okay, don't go in. You don't need to. Just stay home. Okay, it's the safest place to be. And it's not just your oncology visits. Some people have physical therapy. Some people will, go and see a chiropractor. Whatever. And there may be some offices that really aren't fully in tune to what's going on as much as your medical oncologist. So anything that you can cancel and avoid and put off, do it. Stay home. It's the safest place to be. Also, please take into account your support structure, your family members, and all the rest of it. Just because it's your family or a friend doesn't mean they can come and go from the house. Social isolation and social distancing does not mean you just all get to gather at your place.
Right.
Okay, so everyone has to respect that. Otherwise, it defeats the purpose and you're still putting yourself at risk because you don't know who has the virus and who is just asymptomatic.
Right.
If they're coughing, sneezing, have a fever, it's easy.
Yeah.
But so many people aren't going to have symptoms, so you just don't know. So social isolation is really, really key. Okay.
And being vigilant. You're great advice for cancer patients as well as just the rest of us, Dr. Chrysopoulo, because we're all in this new world of sorry, my daughter just came up and it's very hard not to let your kids go out and play with their friends, right? We're on whatever before, but
we were throwing a ball around with my little one, my 8-year-old, the other day. She likes baseball, so she hit a ball, and then just as she hit it, it went quite far, and there was a kid walking past, and the kid grabbed the ball and wanted to come up to my daughter and play and give her the ball, and you can't do that. And so, what do? You don't say, hey, drop it, kid, drop it. It's like, hey, buddy, let's see how far you can throw it, and then over here, let's see how good your arm is, oh, wow, what a great throw, buddy, great. And then it's, you tell your kid, you can't touch that ball.
And go wash the ball.
You have to wash them. Honestly, that's the way, unfortunately, for now, that we have to do.
Well, I'm glad we have humor still. That's the one thing we can't lose during all this. And I'll get some people will give some feedback, some questions. So I'd love to have you on again, Dr. Chrysopoulo.
Whatever you need. Thanks so much for doing this. It's so helpful for everyone. It's also a form of maintaining sanity. It's really key.
Thank you. You helped me. Have a great evening. Thank you.
Of course. You're doing great.
Bye.
See ya.